Hello, my name is Hélène Laurell and I'm working as a university lecturer at the School of Business, Innovation and Sustainability. My research area is within international entrepreneurship and business model innovation with a focus on healthcare and medical technology firms. We aim to better understand how commercialization and adoption of medical technology innovations in ecosystems can be accelerated and aligned. We will also co-develop viable business models together with a number of medical technology firms. We wish to answer the research question, does aligning institutional logics more effectively help to accelerate commercialization and adoption of innovations? Commercializing new medical technology innovations is a challenging process, sometimes requiring 10 to 20 years to become embedded in healthcare practices. Time delays, misalignment of key ecosystem actors, such as those developing new technologies, hospitals and governmental bodies, and resource constraints can amount to substantial losses in value. To gain a deeper understanding, we use an institutional logics approach. This helps researchers to understand how different actors' belief systems and various institutions shape and guide different stakeholders' actions and even non-actions in a health innovation ecosystem. We are working with a group of Swedish digital health startups, medical technology firms, and also investors in an action research project to co-create commercialization roadmaps with the firms and their different stakeholders. We are combining workshops, individual dialogues with the different actors in each firm's innovation ecosystem. We have observations, analysis of written documentation, and a survey. This will help us how their respective institutional logics so far have shaped the firm's commercialization journeys. So far, we have carried out online startup meetings with the firms to understand their different innovation journeys. We have started to identify potential misalignments between the actors, such as those developing the medical technologies and those responsible for public procurements. It is critical for medical technology firms to find payment and reimbursement models that work for them, and also for those responsible for public procurements. In general, we have confirmed that the clinical practice is lagging behind the pace of technology development. The need to reform healthcare by integration of different digital health solutions is all the more important today given the current COVID-19 situation. COVID-19 situation seems to have changed people's attitudes to innovation, and things also happen much faster now by integrating different digital solutions. However, the question is whether this will be sustained once the pandemic is over. The common denominator for innovative medtech firms is that they have to cope with extremely fragmented healthcare systems, involving many different actors that need to carry out and align their activities to get something done. Our research approach should unpack how these actors understand and influence innovation in healthcare and help new medical technology firms to navigate these different institutional logics to speed up their commercialization journeys.